We're going to go ahead and kick things off. Welcome, everyone. We are so glad you're here. We've got a lot jam-packed in the agenda today, so we're going to go ahead and get moving. To get things started for our time together today, we're going to share with you a few greetings from Barry Allen, one of our grant makers with the Bloom Kentucky Initiative. I'm Hannah Edlin. I'm so excited to be here with you all, and we'll go ahead and get started.
I'm delighted to bring you greetings on behalf of the 32 grant-making organizations from around the Commonwealth that formed a coalition in 2019 to engage for the first time ever in a united statewide public policy advocacy initiative to reduce the impact of adverse childhood experiences and to give Kentucky children and families reasons to hope, which in turn will result in a healthier, more prosperous future for all Kentuckians. This initiative was branded as Bloom Kentucky. What is important for you to know and what is so unique, exciting, and satisfying about Bloom Kentucky is these grant makers decided to move out of our comfort zones of making grants and into policy advocacy as a new part of our missions. We came to the realization that after decades and millions of dollars in grants to hundreds of worthy charitable organizations, that our dollars and our efforts were not moving the needle, and the relief being provided was only temporary. So to effect systemic change required us to shift into the realm of advocacy, which for us includes education and awareness, not lobbying. We are seeking the attention of policymakers as well as the general public. We are educating, encouraging, and enabling policymakers to do three things. One, to plead the case. Two, to enact policy change. And three, to provide funding that will address the multi-generational challenges of adverse childhood experiences and move upstream to prevent these experiences from occurring in the first place. We are indebted in particular to Ben Chandler, president of the Foundation for a Healthy Kentucky, for his guidance and encouragement all along the way, and to Terry Brooks, Shannon Moody, and the KYA Bloom Kentucky team for their capable and competent assistance as the backbone organization for this initiative. According to the late Fred Rogers of the children's TV series Mr. Rogers' Neighborhood, the future belongs to those who give it hope. So I want to thank each of you and every one of you and your organizations for holding in your hearts with compassion these victims of child abuse and neglect, and for the passion by which you are making a difference for the current and future generations in moving them from helplessness to hopefulness. It did not take our coalition long to realize the high correlation between ACEs and addiction. So a representative group of grant makers of Kentucky, from which Bloom Kentucky was launched, reached out to then Attorney General Daniel Cameron and the Kentucky Opioid Abatement Advisory Commission's leadership to plead the case for at least 50% of the settlement dollars to be applied to prevention, and to offer the Commission the benefit of the collective wisdom and experience in grant making of our group across the state. We were gratified by the Commission's positive response to allow us to be helpful in whatever ways we could. And we look forward to working with Executive Director Chris Evans, Deputy Director Jesse Halliday, and their staff as they fulfill the legislative mandate to distribute these settlement dollars to achieve the most promising results possible. In closing, let me thank each of you and your organization for all you have done, all you are doing, and all you will do to cultivate a commonwealth where children and families can flourish. Together we can and we shall make this happen. So my challenge to all of us is this. Let's be resistant and not give in. Let's be consistent and not give up. And let's be persistent and not give out. Thank you and enjoy the webinar.
We so appreciate Barry's kind words. We've got some goals identified for this webinar, and we hope that you find several takeaways from today. We hope you gain an understanding of the opioid settlement funds, learn more about the application process, hear about prevention efforts that target early adversity, access information to consider during the process, and have an opportunity to provide feedback about the application experience. And we'll talk more about that. We've got some special guests with us today, Executive Director Chris Evans and Deputy Director Jesse Halliday with the Kentucky Opioid Abatement Advisory Commission and the Kentucky Office of the Attorney General. I will now turn it over to them to get us started, to tell us a little bit more about these historic funds and more about their work.
Thank you, Hannah. I appreciate the introduction, appreciate the opportunity. First of all, I just want to get a chance to say thank you to all of you, not just for being on today, but for the work that you do. It's of critical importance to the Commonwealth. And each time that Jesse and I get the opportunity to speak with you or hear about the work that you're doing, we realize the impactful work that's going on and what you're doing. And we hope in our work to be able to continue to celebrate that and highlight what you're doing. Just a little bit by way of background, because we keep getting asked about a little bit of who we are and who are the people that are behind a little bit of dealing with the commission and the money that goes forward. Again, Chris Evans, I've kind of had a career in service primarily with the Drug Enforcement Administration for 29 years. I am not a native of Kentucky, as the question always comes up. I'm a military brat, so I was somebody who moved every 3 years, and I've kind of lived all across the country. But in 2018, I was brought to Kentucky and took over operations here in Tennessee and West Virginia. And people have asked me about the DEA and how does that tie in with these things. And I point to the other aspects of the job that people don't really realize. Work such as in 2018 when I worked with the Mark Wahlberg Foundation to put on an education forum for about opioids to about 8,000 JCPS students. So that's the Chris Evans that I hope that you look for and understand and focus on as we go forward and go through those things. So again, 29 years with DEA. I served as the chief of operations also, which meant I oversaw DEA's foreign and domestic operations throughout the world. So about 360 offices total. And again, very happy to be in this operation, this position to work with all of you as we go through and try to go through with the commission funds. Before we dive into the commission funds and what the commission does and how that works, I want to make sure I give Jesse an opportunity to introduce yourself also. So, Jesse.
Thank you, Chris. Thank you all for joining today and taking an interest in the work of the commission. I am Jesse Halliday. I'm a native Detroiter, but I have lived in Louisville for the past 20 plus years, and my roots go way back since my mom was born and raised in Louisville. So I spent my life coming to Kentucky over my whole life. So happy to make Kentucky my home for the past 20 years, and just really excited to be able to engage in this really critical, important work in these historic funds that have come to our state, our Commonwealth, and try to utilize them in the best, most effective way that we can to save some lives and change trajectory for some people, and hopefully never see them get into the addiction. So really excited to be here with you all, and looking forward to engaging with you all over the course of our work. Chris?
Thanks, Jesse. As Jesse, one of the key things that Jesse said, also not just who she is and the importance of the things that she brings to the table, but the view that we share about the work that the commission does is to help save lives and support your work in doing that. For those of you who aren't familiar with it, the commission is basically overseeing the distribution of the settlement money, which is coming to the state as a result of the opioid manufacturers and distribution practices that they had. So that total figure is over 800 millions. That figure is split in half. Half of it goes to the state, and again, the other half to counties and local municipalities. For the half that comes to the state, there is the Opioid Abatement Commission, 9 members, selected by position as laid out in the statute. So it's not something where we just made a determination on to be this person or that person. The statute actually lays out by position from the public health sector, from the Justice Cabinet, as well as at large. somebody representing victims. So those 9 members are set by the guidelines of the statute from the state, and that's what moves forward. Those members then are broken down into 2 subcommittees. One handles prevention, as a lot of folks what we're talking about, the other treatment and recovery. And so currently in the process to this point has been that the body has served a lot as a functioning fiduciary to help review grants and get those things out and the money spent. And one of the things that was important to the commission as it was stood up initially was to make sure to get that money out of the state's hands and into your hands for use and availability to put in practice. And that's something which we're really looking to continue on and move. Jesse and I have been here since January. So as you can tell, we've got just enough information to be dangerous, but there's a history of that we're trying to go through, and we're still trying to make sure that we move things forward. I think the key things I want to make sure to leave with you is that right now, a lot of what we're doing is listening and learning. And the thing behind that is we want to make sure that we can make the process and the grant application process and all the other process involved with it simpler, smoother, and with more clarity for people as they're going through the process. We want to be transparent about what we're doing, and we want to make sure people have the ability from organizations throughout the state, doesn't matter your size, we want everybody to be able to go in, to apply, to determine if it's good for them and their organization. So to be able to move forward with the grant request. So we're really looking to try to make this as user-friendly as we can as a government product. There's only so much we can do since it's the money that's come through the government, but we really think there's some ways that we can try to help make things better. And again, the goal of the commission, the goal of us and our drive is to really find ways to support your work. Those 2 buckets that we talked about that the commission goes through has to divide the money that's available at the time. The state did not get all the money at the one shot. The money comes in different segments and from the settlements, so that the amount of money that goes out will vary at different times. So you may hear, hey, the first wave that went out was around $8.5 million. And the subsequent wave is different. There may be some variety in terms of how much availability the commission has to give out funds based on the settlements that come through. So that's a really long-winded and government-sounding way to say the money's not here all set and ready, waiting where we can just hand it out. It's kind of a process that we've got to go through. So we try to make sure people know that so that they have clarity that, hey, that's all the money's not sitting there and we can't just hand it out. But we would love to hear, and we want to make sure you're responsive to your time. If there's thoughts or questions you have, again, we're really looking to work and support your work. But if there are things about the process or about the commission that you'd like some clarity on, Jesse and I are here, and we'd be happy to take those questions and answer those.
And if folks do have questions now, you can go ahead and raise your hand or unmute yourself and ask those. Make sure that they're not specific to proposals, but just a little more general about the commission activities. We really appreciate both Chris and Jesse taking some time to be available for a couple of questions if you've got them. I see a hand raised from Jess Wells.
Hi, can you all hear me? Yeah, okay. Thanks so much for being here. I appreciate y'all's time. I'm from with Big Brothers Big Sisters of Kentuckiana. Just had a question about the reporting requirements associated with the grant.
So I'll just jump in and take that. We had each grant, when it is awarded, has some individualized reporting requirements that come with the application. One of the things that Chris and I are working on is, as this process evolves, that will evolve as well, and having some general reporting requirements as well as project specific. If you already received a grant and have been told what it is you're supposed to report, we'll be rolling out shortly some ways to do that in an electronic way, as opposed to sending emails and reporting that way. In going forward, all of that will happen through the IntelliGrant system. So we're building out those reports. So it should be fairly easy to do the reporting that will be required from the commission.
Awesome, thank you.
Thanks, Jess. Any other questions? So I've got a question about, in the chat from Sonia, about the cycle of submission of grants. Would you all mind to talk about the next kind of time frame for those?
Sure. So it's at this point, again, we're in the current cycle. When we came in, the cycle was scheduled from January 1st to the end of this month, to the end of March. That's something which we wanted to make sure continued on. We didn't want to interrupt the cycle or make changes during that cycle to make sure that we didn't interrupt anybody's operations. We are looking, the unfortunate side is that this does not coincide with the state cycles and funding years. So we understand that that causes some issues and some burdens that quite honestly, Jesse's been working through with a number of folks to try to get through. So we're looking at opening up another cycle, hopefully at some point later, but in this year, but we're trying to, again, get through this first cycle and then figure out what the next one looks through. We also have to figure out and see again how the funds come in and what opportunities that gives to us. Jesse, if you want to add to that.
Just real quickly that we have not set the next grant application process. So the only thing that is set now is the one that's currently open. But as Chris said, we are working to get everyone on the fiscal year, the state fiscal year of July 1. So we anticipate that would be the cycle moving forward. I know someone asked about the grant cycle in the chat. So we are hoping to get on a more regular, that grant funding would be available July 1 of each year following an annual award cycle. But those dates haven't been set, and we're still trying to work through that as we go from the past was to get the money out really quickly. So that's why we are where we are.
So I'm Sonia Gray with Echo. Thank you for answering that. So I guess my question is, right now there is an open application to submit grants at this point in time, and the deadline is at the end of March 31.
Yes, ma'am.
Okay, and I guess that what we would do is just provide what our fiscal year is and kind of dating, like this is the time frame that we would utilize those dollars. Is that kind of what is going on right now?
You would, according to this grant cycle, you would present a 12-month budget and how you would use that money over a 12-month period. I do want to, because I have you all here, like the process of closing it in March is not going to allow for the commission to go through all the vetting and then establish the state contracts to have them ready for a July 1. So while we don't have a specific date that would start, it's most likely going to be a little closer to the fall. So for thinking about how you're building out that 12-month budget, we can't give you an exact start date. What I can tell you is that the grants that were awarded around that same time last year ended up with a payment cycle that started September 1. So we're sort of using that as our guide about how much time it will take to get through the state contract process. And we know that this is wonky for people. And so we appreciate the patience as we work through that.
I know you all are limited on time. I'm wondering, there's a couple of other questions in the chat. If those could be answered like within the time that you all have. There's a couple of questions, Jesse, I think you're seeing them.
I can see them. One, the partnership is welcomed and suggested, and we've had several grants that have come through the process that had partnerships. There's no statutory prohibition on a multi-agency or multi-group grant, so partnerships are certainly allowed. And then as far as the funding years, the settlement dollars are spread out over about an 18-year process. But again, it's still hard to know exactly how many years will have significant funds and how those will get distributed. So that's going to take a little bit of time to figure out an exact number of years of funding. And then we don't have a specific number yet on how much will be awarded or how many grants that will translate into for this year. So what we do know based on previous award cycles, there will be a lot more asks than we have money to give out. and the commission will be undergoing a process that's outlined in our regs about what they can look at in terms of scope and reach for each grant to weigh what they want to fund, what is fundable this cycle and what is not. And just, I see really quickly a question about new programming. It is one of the requirements of the grants is not to supplant. So you cannot, and the definition of supplanting is basically take this money to do something you had already operationalized. That doesn't necessarily mean it has to be brand new programming, but for example, if you no longer had funding to do something you did 5 years ago or had previously done, you could potentially request that, but you can't, if you've already operationalized a staff member's salary, for example, into another funding stream, you can't simply swap this money out to do that. And I just see really quickly this question about priority funding and programming. At this point, there's not anything that's restricting what you ask for other than what is outlined in the statute, which is 29 different uses of the funds, and then some restrictions that were put in the notice of funding, which included no purchases of land, no vehicles, no construction, renovation costs, those things that are in the application. But if you feel like you could articulate a reason to that if the settlement funds are allowable, you are able to put that in as a request.
I would just say that's one of the questions that we've tried to be very good about answering and point, but our hands are tied a little bit about giving clarity. We're very often asked about, hey, is this the right thing to put forward, or will this get prioritization, or how will the commission look at that? And we're struck by the guidelines and not really being able to give a lot of things. So we need you to, if you feel it's appropriate, then we tell people then absolutely submit and we'll go through. But we don't want people to be frustrated by the response when we're not giving them very directed guidance, but we want to make sure, again, for the process that we're kind of limited in terms of what we can do. So please definitely take a look at it. And if you think it meets the criteria, then we encourage people to apply.
There was one question about financial access. We at this point are not doing reimbursements. It's money that comes up front. The original grants were one payment up front. We may have to break that into 2 payments depending on, but it would not be reimbursable funding. It would be funding you would get up front, and then we would monitor that you're spending it in the way that you told us that you were going to spend it. And I will put the link to our website in here, which is where you can get the link to our application, as well as there's a listing of all the things that have been funded generally, whether they were treatment, prevention, where they occurred, and what organization received the funding. And this question about projects serving anyone or does current prior opioid misuse, all funds must be tied to opioid abatement. So people in recovery, people who are at prevention from opioid use, but there must be a very clear nexus to opioid use. And currently we have only allowing one grant per organization. And so if you are partnering with an organization and you are the main applicant, that would be, I think, allowable in how it is set up, but you cannot be the primary applicant for more than one application at this point. Oh, I see somebody beat me to it. Thank you, Shannon, for posting that.
Chris or Jesse, any last minute remarks before we transition? I know that you all, we've taken more time than I think we had asked initially, so we really appreciate you being generous with that.
I just want to say again, thanks to everybody for joining, and we appreciate it. And it's so supportive of the work you're doing, and we just encourage you to keep doing what you're doing as you're moving forward. And we look forward to trying to find ways to make sure we can support your work.
Thank you all.
Yeah, thank you so much. We'll continue capturing questions and send them your all's way. And we have a survey as well. So thank you so much. We'll see y'all soon. we have a brief presentation around ideas related to what prevention could look like. And also some examples of organizations that have had the opportunity to utilize opioid abatement commission funding that are pretty oriented around prevention. So I will run through that pretty quickly because it is information that we anticipate a lot of folks know or at least understand. And but we wanted to bring some research into it and also provide some opportunities for y'all to get access to that research in case you wanted it. But within Bloom, Kentucky, the way that we think about prevention of substance use and abuse is through creating opportunities to mitigate or prevent adverse childhood experiences or childhood adversity. So I'm going to go through really quickly a couple of data points from research to just consider as we're walking through this. So abuse and neglect and household dysfunction, we know increases the likelihood of early initiation of illicit drug use by 2 to 4-fold. It makes sense, right? Early adversity creates hardship, difficulty in coping. Teens who have experienced physical or sexual abuse assault were 3 times more likely to report past or current substance abuse than those without a history of trauma. We know that adolescent opioid use has been strongly linked to depression. 4% or nearly 4% of adolescents have reported misusing pain medication. One of the things that kind of blew my mind was that adolescents living in rural settings are 35% more likely to misuse prescription opioids compared to youth living in large urban areas. I think there's a couple of ways to think about that, but what do we think that's about? Access to supports, is it, just some considerations there. Additionally, individuals who report taking prescription opioids for medical purposes during high school have a 33% greater risk of misusing opioids by the age of 23. Use in high school could lead to misuse in early adulthood. And then opioid use disorder frequently, people who experience opioid use disorder frequently report experiencing child maltreatment. And I think that continues to make the case for why trauma-informed interventions are so critical. Estrella, we've got the references for all of these. We'll send the slides out, but yeah, I got you. And then every increase of one trauma was associated with 12 to 23% increase in odds of early initiation of opioid use across those 7 use indicators that are measured. So really strong and clear ties between adversity and opioid use. So on the next slide, many folks are familiar with this, but when we talk about adversity, these are the things that we talk about: childhood experiences as well as adverse community environments. When things are not going well at home, when we are constantly and chronically dealing with stress and there are no ways to mitigate that, then our body is going to respond and our mind is going to respond in ways that are behaviorally or that create challenges within both childhood and adulthood. So I think conceptually, most people understand and know this, but we wanted to throw that out there for folks who have not seen that before. On the next slide, we've got some data points related to what Kentucky sees related to this pair of ACEs. So we know that we are in the top 10 for kids who have a parent with who is incarcerated or experienced incarceration. We are number 14 in the nation for child maltreatment. We have high rates of domestic violence and kids witnessing domestic violence, and high rates of mental health issues and substance use issues that often, if are untreated, can be really problematic. We also know that housing instability, poverty, community violence creates those same stressors for kids and is something to consider. On the next slide, I want to talk about what it looks like to overcome those, because these things are these things are things that we can overcome. I saw something the other day that said that ACEs are facts, not fate. And I like the way that is framed, because it doesn't mean just because you experience adversity that you are more likely to misuse substances or have chronic illnesses. So positive childhood experiences, just like adverse childhood experiences, have this same dose response, whereas the more positive childhood experiences you get, the better off your mental health is. The positive childhood experiences that have been identified through research, especially by Dr. Christina Bethel, are laid out here. And I want to talk through on the next slide a little bit more in depth of what that can look like in the community. So there's this HOPE initiative that is based out of Tufts University that talks about the 4 building blocks of HOPE. It's a Healthy Outcomes for Positive Experiences initiative. And they talk about the need for these 4 building blocks in order for kids to experience a positive childhood and also overcome any adversity that they're dealing with. Safe and supportive relationships, safe, stable, equitable environments, opportunities for engagement, opportunities for emotional growth. Think about the supportive programming that you do, that organizations in your communities do, that really lend to building those blocks for kids in order to create positive experiences for them. Everything from safe, affordable childcare and housing to out of school time opportunities and just about everything in between. So on the next slide, threw in a little bit more research, and there are references at the end here. What we know is that the pandemic also exacerbated youth mental health. And what we saw based on some recent research is that youth who experienced and reported feeling extreme stress from the uncertainty of the pandemic were 2.4 times more likely to use substances compared to youth who had identified feeling just slightly stressed or very slight stress. So what that tells us and what we continue to learn and know is that when we mitigate the impact of stress, especially chronic stress, increasing access to resources and positive coping skills reduces the likelihood of antisocial and or negative coping mechanisms down the road, including misusing substances or opioid misuse. And then on the next slide, we've got a framework to think about what prevention can look like when you all are considering within your programming prevention of opioid misuse or prevention of youth utilizing or misusing substances. This is from the Centers for Disease Control. This is a framework that they have identified. And this is pretty program focused, but it lays out strategy and approach based on kind of where you are, whether you're serving, young families, whether you're serving older adolescents, whether you're serving adults, thinking about how to create that strategy in your community, and then considering the approach to move forward with in order to address ACEs, and then ideally long-term reduce the likelihood of misusing substances. So on the next slide, I go a little bit more in depth. So on the CDC's framework there, that's really very, very prevention focused. And you can think about that when we think about primary prevention. So this slide really kind of talks about tertiary prevention. So if you are working directly with young people and adolescents where you're concerned about the potential for substance use disorder or substance misuse for adolescents, there is a really good systematic review around programming evidence-based interventions for reducing or preventing substance use disorder in adolescents. And they had outlined some really key components of a program that are effective. So if it's a school-based prevention program, more effective programs are highly interactive, skills-focused, take place over multiple years. If you're utilizing family-based preventions for preventing SUDs, those programs combine parenting skills and family bonding components. That goes back to that strengthening families approach. And then community based prevention is most effective when there's a combination of the other two, really, and then mass media policy with a really clear and coordinated message across multiple delivery components. And I just noticed a typo there, and I need to go back and change that before we send that out. So that's a really quick overview of prevention, because I want to make sure that we have a lot of time for our folks who have volunteered to talk to us about what they are doing in their communities with the Opioid Abatement Advisory Commission funding that they had received. So I believe I'm turning it over to Bruce Couch to talk about their work in Taylor County. Bruce?
Hey, good afternoon. So I was put on task. I'm actually one of the school resource officers here, and was put on task to come up with some type of program to mitigate those risks that you just talked about with the ACEs. And I, with my background coming out of Lexington and the jobs that I've done up there, I'm a firm believer that we have to swim upstream. We need to, address our kids, and we need to get with those guys before any kind of situation occurs and kind of help those kids. So that was kind of my focus, was let's start with them young. So I really focus on, I do a third grade program now in the summer. That's part of we use with abatement funds, but we really focus during school year, fourth, fifth, sixth, and we're wanting to next year bring in seventh grade. We teach the Too Good for Drugs program. So the first year I formed a group, our youth coalition. We started with 10 high school students. They were all pretty eager to get into the middle school and to the elementary school and talk to the students, the younger students. Most of those 10 were very respected in the school. They're looked at as peers already, either athletes or academically. We've now grown. We're at 32 students in the youth coalition. Some of the pictures that you see, you'll see some of our some of the high school kids. They actually go in when we are teaching the program and are actually mentoring while we're doing those programs. So these kids see the high school students out there coming in and interacting with them. So they even ask, when are those guys coming back if they miss a week or something with us. But right now, I would say my fifth grade class, I've had them now for 2 years, and the interactions that we have is amazing. Even the teachers are talking about how they're responding to us. So that's with our funds. We use those funds so we can hire and actually have somebody dedicated to help teach the class. We also purchased the impairment goggles. We use those with the high school students. We have the drug, THC, and alcohol. We do that every 9 weeks, where we do some type of drug and alcohol awareness that we do with them. First 9 weeks, we actually used golf carts, set up an obstacle course. Kids really responded with it. I have a high school student myself, and all day long, the kids come up to him and said, "Hey, your dad's here with the goggles again." So they're excited to kind of learn. And last time we did an actual just kind of just do an ordinary task, and how difficult it is being under the influence. And the kids were actually when they were doing it, talking about just finding your keys on the floor. If you dropped your keys on the floor, how difficult it was just to pick those up. But I've seen, I've seen at the time, this is be my third year back here in my hometown, and seeing the kids grow, it's been amazing with that. So
We really appreciate you bringing this example, and it sounds like the work you all doing is just incredible. Bruce, I'm wondering, would you be open if folks were interested in reaching out to learn more in depth? Would you be open to having conversations?
Yeah, absolutely.
Okay, I appreciate that. Thanks so much. From Yes Arts, we have Elle Travis. Elle, would you like to jump in?
Yes, hi everybody. And I apologize in advance. I'm a little bit hoarse. I'm coming off of being sick this past week. My name is Elle Travis. I'm the executive director with Yes Arts. And if you want to advance the next slide, I'm going to move pretty quick because I've got a lot and I don't want us to go over on time. Yes Arts started as an organization in 2015 when Doris Thurber, our founding artist, lost her daughter Maya, who was 22 at the time, to a heroin fentanyl overdose. And about a year and a half into her grieving process, she realized that she really needed to be using her artistic skills and her links in our community to try and help people who are in early recovery through the arts. And so she partnered with 2 other local artists, and they began a program called Hands Healing Hearts. And that was a partnership with Franklin County Drug Court, just specifically women, and a weekly arts class. You can advance. In 2018, Yes Arts became a 501c3 under the name of Hands Healing Hearts. And then the following year, we started doing business as Yes Arts. And today, as of 2021, we have an art center in the heart of downtown Frankfort, located at City Hall, which is an inclusive space where all people can create and heal. And our new mission is mobilizing the power of community and the arts to disrupt the cycle of addiction. So who do we serve? We work within 3 kind of buckets: recovery, youth, which is our prevention model, and community. So first, I'll do a really quick snippet about our recovery program, if you'll advance the slide. Our ART program stands for Achieving Recovery Together, and that is that original pilot program of working with people in early recovery through the Franklin County Drug Court program, as well as other local nonprofit partners. If you'll move up one more slide. So in 2016, we were an art class led by a local artist. That was our original program. In 2020, we moved into virtual classes during the pandemic. And that was when I kind of stepped into the role, which I'm in recovery. I just celebrated 10 years in December. And so I came in as a peer support with a background in the arts to lead those virtual classes. And then when we got our building, we made another shift to actually bringing an art therapist on. And we now have two peer supports who work within those programs. And on to our youth prevention program, which is why I'm here to talk to you all today. We call this program YAY, which is fun because it is fun. Working with youth in our community is amazing. And so Yes Arts Youth, if you want to move forward one slide, is a robust youth prevention program. It does exist to create a space in our facility that is inclusive for children of all ages and abilities. And all of our programs do revolve around protective factors. And that is the model that we follow. So strong mentorships, lasting friendships, and that quality arts instruction, which will in turn over the length of time that our community grows with us, will reduce their risk of falling into the cycle of addiction. And our hope is to mitigate harm along the way due to our program leaders and youth mentors being trained on trauma-informed care, implicit bias, neurodiversity, child abuse prevention, and of course, ACEs, risk and protective factors. And all of our programs are evidence-based and data-driven. And of course, we do work in all stages of the cycle of addiction, from that primary prevention program, which is open to all students in a variety of ages, all the way up through our recovery programming. And so you can see in these photos here, in all of these photos, where we've got children from school groups, we have team members, program leaders, we've got youth, and we really lean into the mentorship side of things. So you can see the 2 girls with the trays of food. We do hire high school students. We pay them and train them on all of those topics to mentor the young students. We also allow middle schoolers to come in and take etiquette courses and become youth servers at our gallery events and things of that nature. So it's really a transitional program to move students from the core programming where they're coming to making art, moving into other roles as middle school and then into high school. And then we now have shifted to where our high school students are returning from college to come back to be program leaders. So it's really a full cycle. And the last piece is our community programs. We have a Black Women Artist of Frankfurt network, as well as galleries in our building and outreach activities. So I want to tell you all just really quickly a little bit about strategy. So in early 2023, last year, a bunch of organizations from our local ASAP chapter, which is our Agency for Substance Abuse Prevention, came together to talk about opioid abatement funds, as everyone was doing. And ultimately, 8 of us whittled down to a small group, which formed an alliance, which we call the Opioid Abatement Alliance in Franklin County. We hosted weekly planning meetings, and we brought in, Yes Arts brought in our strategic planner, who helped us host almost like community strategic planning to analyze our shared data, identify gaps in services and those barriers to care. So once we identified those problems, we were able to, as a community and a group of different organizations, from shelters to folks like us working with youth, we were able to kind of identify some goals and outcomes. And then we created some documents that we used in a shared narrative to apply for our funding. And so some of those shared documents looked like an ecosystem of care graphic, which I will share in a moment, that shared narrative, a partner MOU, letters of support. We created an alliance budget that included everyone in our community who was applying together. And then, of course, some press releases and photos and things of that nature. So the next one is the ecosystem of care graphic that we created. And as you can see around this wheel, each loop kind of creates the visual to show where each organization is working, from universal through recovery. And so you see Yes Arts up there in the top middle, and we hit all pieces of that pie, as well as many of our other partners who were applying. And so you can really see how we're going to blanket our community collectively, if funded, together, how we can really, blanket our community in care. And you can move forward one more. This is just a joint resolution. I couldn't find the one that was signed because I was in a hurry trying to put this together, but we did have a joint resolution with our city and county government that was supported by our mayor and our judge executive. And so they just expressed their support of our community doing this together and creating these alliances. And then this is that budget that I shared with you, where we worked with our partners who were also applying. We did each apply separately, but had that shared narrative and shared graphic and budget. And then this is our group, our alliance group of partners. Not all of us were funded in this first round. I'll just go on and say that. As the commission stated, they don't have money to fund everybody, and there were some really great people and organizations who weren't funded this first round. And I'll just talk really fast about goals and outcomes. We did collectively develop our goals as an alliance, and then created specific outcomes dedicated to our organization. So these are our goals and outcomes. We had 4 goals about prevention of substance use in our community, supporting the reduction of rates of recidivism in drug court, promoting mental and behavioral health in Franklin County and surrounding, and then increasing collaboration with community partners in order to address some of the negative outcomes, as well as to become a certified recovery care community. And then you can see that those outcomes align directly with those. And then I'll just leave you all with a few key takeaways, because I know we are on a time limit, but basically, just be sure to paint a clear picture of the work your organization is doing and how it's going to directly impact opioid use disorder in your community. Be creative in your approach, but be sure that your programs are also backed by data and have the ability to show evidence and success. Partnerships are really well supported, in my opinion, and I feel like that shows that you're really making that impact across your community. And then don't forget to assess the gaps and the underserved population so you can identify where the greatest needs lie. And then the last piece is just not everyone can be funded, even the strongest organizations, and it cuts off, but it just says, don't give up. So even if you don't get funded the first cycle that you apply, there are a lot of dollars out there, and they need to be going to organizations in Kentucky who are doing the greatest work. And so just keep on keeping on. I think that's all I have. Thank you all so much. Hopefully I didn't take too much time.
Elle, you were phenomenal and also covered a really a lot of information in a concise time frame, and appreciate. I think I would love to have you, back and continue talking. You and Bruce continue to just dig in and do a deep dive on the work that you all are doing. I love that you had that collective of folks as well. So a lot of what Al and Bruce have talked about, we're going to talk a little bit more about is utilizing information that's already available, utilizing best practice and evidence, and doing that collectively and partnering. We have the Bloom Kentucky toolkits here identified, and we can drop those in the chat and also send them as a follow-up. And they have some outlines and ideas on how to start the process of developing out a proposal, including that gap analysis, assessing your community. And then we've got a little bit more information about on the visual about what the statute says as far as what's allowed, just to keep in mind. And then on the next slide, I think it's a callback to what Elle was talking about as far as the process that they used. This is a strategic prevention framework from SAMHSA. This is, I think, a really great tool on what to think about as you're developing out a proposal. I know a lot of folks who are on this call have done, grant proposals for many different organizations and foundations, but sometimes it's good to come back to a framework and use that as a step-by-step process. So again, we'll send that out as a follow-up in an email. And then I believe I'm turning it over to my colleague, Hannah Edlin, to wrap us up.
Absolutely. Well, thank you everyone for being here with us this afternoon. A special thank you to all of our guests. Thank you for sharing your stories and those important little nuggets that help in this process. So I want to close by just saying thank you. And then as a quick wrap up, I want to let you know about our regional listening and learning sessions. We've got some wonderful session opportunities that are customizable to your community's needs. Whether you want to dive in a little bit more to ACEs or talk about some kids count data, or even talk more about opioid abatement funds, we'd be happy to set up those sessions. You will be getting a follow-up email with all these great resources. Our team has been capturing all the dialogue and the questions in the chat. So we are going to help find those answers and get that to you as well. And if you have any questions, feel free to reach out to those folks. And there is a survey. So if you're new to the QR code, you can hold up your phone, go to your camera app, and if you hover over that QR code, it should allow you access to that survey. We will also be sending this survey out via email, but this will help us grow and it will also help us better serve you. But otherwise, that's all I've got. Thank you all so much for being here, and I hope you all have an amazing rest of your week. Thank you. Hi, everyone. Thanks for tuning in.